Most common option which people prefer after MBBS is taking a post-graduation seat, and the commonly preferred pathway for doing it is the NEET PG examination. NEET PG is nothing but it is a national, it is a exam which is similar to your NEET UG. So it's more or less like your NEET UG, but here you'll be having MCQs, and the mark which you are going to get here will determine which branch and which college and which degree you are going to take in future. I think for people like you, especially those who have joined MBBS recently, this NEET PG might be very well replaced by next examination. But more or less, the concept is going to remain the same. So for doing any PG, NEET is the mandatory step in order to get into that path. So this will mostly help you to get admission in the degrees like MD or MS or MCH. Like we have direct MCH after MBBS, like 6 years course for pediatric surgery, neurosurgery and all is there, or even the DNB degree. For all of it, the pathway, the single pathway is the NEET PG examination. What is the difference between MD or MS versus DNB? There is practically there is no great difference, but the key differentiating point is that MD or MS PGs, they have a greater teaching experience when compared to DNB people, and the passing rate is a bit higher when it comes to MD or MS examination. And what are the different branches which are available you can do? So this looks like a long list, like you have anesthesia, biochemistry, anatomy, dermatology, community medicine, forensic, emergency medicine, general medicine, microbiology, pediatrics, pathology, pharmacology, physiology, PMR, which is physical medical medicine and rehabilitation, psychiatry, radiology, ENT, surgery, obstetrics and gynecology, ophthalmology, orthopedics, and lot other courses. So this is not an exhaustive list. This is not a comprehensive list, but I have tried to compile the key things, key branches which are commonly preferred after. And there are very few degrees which are offered exclusively by some colleges. Like the degree which I am doing is a community and family medicine degree, which is offered only at AIIMS. So these are the way. There are a lot of postgraduate options post your MBBS. So right from your first year, you need to actively keep an eye on various branches. You need to be aware that such branches exist, and whenever you're posted in those branches, whenever you are learning those subjects, you should be actively trying to analyze the pros and cons, and what you feel and experience about the subject. You need to try to document it. Not only knowing it or being conscious about it is important, but you need to try to document it whenever you're having a encounter with the subject, because your perception about the subject will keep on changing with time. And when you have it documented, then it will be very comfortable for you to choose which branch will be the apt one for you at the end of MBBS. So there are a lot of YouTube videos available by different toppers, different NEET PG toppers, which I used to watch constantly before getting into PG. So I would also urge you to watch such videos by various toppers interviews given on YouTube, because again it is going to add more perspective about how you see things, and how things work. Plus also which branch to choose also. And how to prepare for it also. For both of this, you need to have an eye on the interviews which are available on the YouTube. So during my PG preparation, I used to every single day I used to watch at least one video given by a topper. So there are hundreds of strategies available for preparing, but which one suits you the best, you need to experiment by yourself and do. And experimenting would take a lot of time, and when you are trying, when you are getting this perspective, or when you are trying to see things in the view of PG preparation at the end of your MBBS, then it will be very challenging, and the amount of time you have is very limited. Whereas from right now, if you are able to just have that dimension in your mind, it will be very helpful for you. You might be thinking, இப்போ தான் ஃபஸ்ட் இயரே வந்து சேர்ந்துருக்கோம், அதுக்கு முன்னாடி இவ்வளோ பேசுகிறீங்க பிஜி ப்ரிப்ரேஷன் பற்றி, நான் இப்போவே ஸ்டார்ட் பண்ணி ஆகணுமான்னு கேட்டால், that is totally upon you. It is completely upon your convenience, but you should be at least oriented and know how things work, how other college people think. Like there is a lot of difference between a student studying in state college versus a MBBS student studying in central institute. The orientation is completely different, and how to bridge this gap you can bridge this gap by interacting with friends who are in other colleges, and by watching the interviews of people who have cleared MBBS, who have cleared the PG, so that you'll be able to try to adopt those strategies which they followed, and you can experiment with it. And when you are starting to experiment with those strategies right from first year, you will have enough time, and you will be able to find which strategy is more suitable for you. And